So Bartonella Henselae. So the symptoms include cold hands and or feet. So oftentimes this will persist even after we fix somebody's thyroid. They'll still be cold. And this is because Bartonella likes to live in the blood vessels as well as in the skin. So you'll see that there'll be symptoms associated with both of those. So occasional fever, sometimes this is every couple of days, every couple of weeks, but occasionally at night. And they may have some sweating and some fevers, but it's not as extreme as babesia. They'll have fatigue, they'll have soreness, sharp pains, or discomfort on the soles of the feet, where they feel like they need to wear slippers all the time, oftentimes misdiagnosed as plantar fasciitis. Sharp shooting knife-like headaches. They'll have joint pain, usually in a single joint, oftentimes wrist, hands, thumb joint is a really significant one. Sometimes elbow, hip is a big one, sometimes ankles. It can be multiples, but usually there's just one joint that's quite bad. Muscle pain can be severe. Oftentimes these people have been diagnosed with fibromyalgia because of the pain in the muscles. Neck pain, low back pain. It's important to remember what the actual mechanism here is for all of these bugs, is that the bug is present and the immune system is trying to get rid of it. And in order to do that, the immune system mounts a reaction and an inflammatory reaction. So the inflammation comes, all of these bugs come from all around, immune system's like, hey, come help me. Here comes the immune system, and it goes to attack the bug, and it's not able to get rid of the bug because the bug is usually hiding someplace. Let's say Bartonella is hiding in the thyroid. The immune system is trying to get at it, and in the process, it is destroying the thyroid as it's trying to get at the Bartonella, and that's Hashimoto's. So any sort of it's trying to get at it through the muscles. You're going to get a myalgia, or basically inflammation in the muscles. So once you remove the Bartonella, then there's nothing to attack anymore, and that's what quiets down the inflammation and the pain. So insomnia can come from Bartonella. You can get stretch marks in weird places. Oftentimes people will have them on the flank, and they'll be like, why do I have that? Unrelated to pregnancy. They'll get muscle cramps typically in the calves at night. They'll have thyroid issues, so hypothyroidism and Hashimoto's. They can have anxiety and depression. They can have high blood pressure because of the inflammation they have in the blood vessels. And then they can have Raynaud's, which has to do with when you go outside in winter, your hands will turn white because they get so cold, and that has to do with the fact that the Bartonella is in the blood vessels, causing it to spasm and shut down so that you're not getting enough blood flow to the hands. So laboratory testing to do is that DNAconnections.com Lyme panel, the urine PCR test, with provocation. And positive is considered when Bartonella is found in that test. So in my experience, it's very likely that someone has a Bartonella infection if they have both of the asterisk symptoms above, and the other symptoms will be confirmatory as well as the urine PCR test. So those that I marked off is the pain in the feet, muscle cramps, oftentimes one or two of the others, but putting it all together is key. And sometimes people have just one of those symptoms, but it can be significant enough. So make your determination.